Let's record this. We're going to start over. Hi, guys. I just remembered to press the record button. We upload these videos to YouTube, and so that's why I wanted to make sure and hit record. But my name is Heidi. I'm one of the co-founders of Freedom Angels. I live in the San Francisco Bay Area, and now I'm tossing it over to Tara.
Hi, I'm Tara, co-founder of Freedom Angels in the Northern Sierra Nevada mountains of California.
So today we are coming. She's not on yet. It's still connecting her audio. So guys, today we are in our 29th day of lockdown. You guys have seen our page is constantly being censored, meaning our Freedom Angels Facebook page. It's fascinating. We're getting growth. Our metrics are amazing on that page, but for some reason, you know, videos aren't being able to be streamed there. We can't do our stories there. People want this information, but it is severely being censored. So every day we pick some new timeline to show up on to broadcast from. So today it let me into my page. Denise is trying to connect via audio right now, guys, but it doesn't look like she's in yet. But before Tara gets going, I just want to tell everybody, because it's so hard to find us, it's really, really important right now that you guys start watch parties and you tag people, tag friends, and that you also share. Our video yesterday, it was crazy how bad they suppressed it. I think Denise is here.
I'm here. Hi, guys.
Hey, glad you can make it. We just did our intro, but you could introduce yourself.
Oh, okay. Well, I'm Denise. I'm a freedom activist in Northern California, San Joaquin County, and I am also co-founder of Freedom Angels.
And they'll probably want to know why you're not on screen, because everybody always worries when Denise is not on the screen.
Oh, I'm fine. I'm fine. We're just having some things here at the house that I can't really be on screen right now, but I'm fully here.
Yes, of course.
We haven't even started talking about anything. What do you guys want to jump in with? There's so much going on.
There's so much. All the beautiful pushback that we're seeing in the States, and now we're seeing Texas is going to open and Pennsylvania is opening. Santa Cruz is opening their beaches. Where do we start?
Okay, where we start.
Michigan.
Sorry, guys. Where we start is that we literally have no viewers on Facebook right now. So while they let me get in and it looks like we're live there.
What page are you on?
I'm on my page. Look at it. I tagged you guys. Do you see viewers?
Let me go look. I don't even see a tag.
Guys, I know we're recording this. You'll see this on YouTube. You can go over to our Facebook.
I can't even find your profile.
See?
I found your profile from my computer. I don't know about from my phone. Let me check from my phone. I found your profile, but there's nothing on it. No people are present.
Oh my goodness. Okay, let me share this. Hold on one second. Hold on. Let me work my magic, ladies.
Let's do it.
That's crazy, Heidi.
While she's working her magic, I'm going to tell the people that are not listening to this live, but will listen to it recorded on YouTube, that yesterday I figured out how badly, I got to see how badly Facebook is suppressing my account specifically. We got on from Primo's account, and so I had access to it, and I was seeing it as we were using the Zoom and live streaming. And then there was something I needed from my personal timeline, and I needed to go get it so that I could copy it onto Primo's page. Well, I'm friends with Primo on Facebook. I went over to my page, had access, and guys, everything I post these days, it's all public. I don't change my settings at all. Everything I have to say is for the world to hear. So anyways, I go to his timeline, and guess what, guys? There were literally no posts. Like, the posts that I was looking for did not exist on his timeline. They are hiding everything I post. And half the things that we post, we're tagging each other in. So clearly Primo is friends with Denise, so you would think he would be able to see Denise's stuff too. Anyways, this is the links they're going to. And yes, this live, I still see no viewers.
I see 13. We are being so heavily censored. I think the only reason why they even have our page up is to see what we're doing at this point. But we can be sure. Yeah, we really know, you guys, we are probably going to be taken down fairly soon. So just please take down our email address to keep in contact, which is freedomangels@protonmail.com, to keep up to date with all the things that we're doing. And we are working on a website so that way we can get up and running and stop depending on social media to get our message out. But we have viewers now, so let's get talking.
I know, I see it. We finally have viewers. Thank you. You figured out a way. So yeah, please comment and ask your questions, because we're trying to watch them, but your comments and your likes and everything really help get this out. So Tara, start with what we saw today around the country.
Okay. Well, Denise, you were talking about the places that are opening up. I mean, you can see that the governors are seeing that people are protesting. People are demanding for their states to be open, to get back to work. And, so there was an article that came out how Michigan's governor, she has decided to start opening on May 1st, which is amazing. The pushback has effect. And apparently that came right after President Trump tweeted out his liberate Michigan and liberate Minnesota and liberate Virginia tweets today. But one of the most important things for all of us to remember is that, for example, in the governor from Michigan in her statement about starting to open up on May 1st, it's still, she's saying, and we're going to ease in here and we're going to have these restrictions. We've got to make sure that there are not conditions based on mandatory testing and contact tracing, which is like digital shackles, basically, surveillance state. Got to make sure that there are not conditions on this. That's really key. So I'm as happy as I am to hear about all these governors. We can't let off on that. No, we are not gonna. The hashtag is no more normal. It's like, no, we can go back. We need to protect our freedoms and that we've had, and actually ensure that nothing like this can happen again. We actually have to go where we haven't been and put in protective measures so that we don't end up in a situation where emergency powers are being abused like this. I mean, obviously there's going to have to be huge constitutional challenges.
Right. And, Heidi, I know Heidi's going to start talking, or I hope Heidi starts talking about what she saw today as far as constitutional protection from our sheriffs and legislators, and people in power. But, we are seeing the pushback in other states and California. Just to let you guys know, we're going to start our pushback on Monday, April 20th at 12 o'clock at the California Capitol. We have a convoy. We also have boots on the ground. So you can choose whichever one you feel most comfortable with. But we are demanding that businesses open up these small mom and pop places that Governor Newsom has decided to shut down. We have Walmart open, we have Target open, all of these big box stores that we're now dependent on versus these mom and pop places that can take the same safety measures that these Walmarts can take and still be in business and still help our economy. Right. The decisions that he's making is tyrannical at this point, and it's time to start pushing back. We need to start getting with business owners to, open up their doors, and we can be there to support that, that opening up. But this is the point. California needs to get back to work. And on top of all the unconstitutional policies that are being put in place by Newsom.
Well, and there was a great rally today in Huntington Beach. People gathered on Main Street in Huntington Beach to demand the very same things, just like they did in St. Paul, Minnesota. They gathered at the governor's house there today. And just so many places are, popping up spontaneously, in their parks, at their, in their main streets. Can you guys see me?
Yes, we can see you.
Something happened to my phone. It's so important because we understand that there's a process for emergency orders. Everybody does. We know that. But the state has to show a compelling interest for those emergency powers. And normally they are to be very restrictive, narrow in scope and in time. They're set for very short periods of time, like to deal with riots and such. This, tied in with our, public health officers, dealing with the pandemic, is very different. And it's this timeline. The compelling state interest and the timeline that are really going to push a lot of these constitutional challenges that are going to be coming. Because, you know, it's very telling when you've been hearing Fauci from his pulpit, been saying over and over again, the virus determines the timeline. He's trying to, and they're manipulated data around it all. But it's very much that's what they're trying to shield themselves with. But you know what? The faulty modeling and data, the manipulated data is going to really, going to be a key piece in this. You want to talk about the Stanford study that just came out today, which ties in exactly to that, the modeling and the stats on infection rates, natural herd immunity, and
first, while we're
death
on
rate.
this real quick, I just want to jump in and, sometimes I talk about, the Q followers and all those things, all that, all that stuff. But what we're seeing from President Trump, what he tweeted today, liberate Michigan, liberate these states that are protesting and pushing back on their governors. As a patriot, as an American, as a human, it is our duty to do this. And this is him telling us, this is what you need to do. We can't sit here and wait for the government to come in and the federal government to come in and save us. This is a state's issue. And as Californians, we need to push back on what Newsom is setting into place, which is that indefinite date, the contact tracing, all of the things that Tara spoke about. But as a patriot, it is your duty to stand up and to join these pushbacks, even if it's a barbecue at the park with your friends, or in your front yard, or opening up your business, joining these convoys. This is what needs to be done, because we can't wait for this king from the federal government to come into every single state and save us time and time again. So it's important to push back. I just wanted to jump in and say that, because I didn't want to forget about President Trump's tweets today.
Right. I get that. And so my piece of the puzzle is I don't want people to get caught up in the shiny objects of, look what the federal government is doing. This is happening. This is doing, Gates is doing this, Fauci's doing this, Trump is doing this. I'm not a Trump person, guys, just so the record is clear. He is our president. I'm not here to bash Trump either, but I'm not here to be like, woohoo Trump, because there's plenty of things that have happened that I don't agree with. So let's knock off this crap. I'm talking about other people being so caught up on who the president is, because the president is only the president for so many years. If you guys are going to usher yourself into this new world order, whether you're going at it because you love Trump or you hate Trump, well, he's not going to be the president forever. Just like 9/11, when the country said, yay, Bush, please bring us the Patriot Act. So it doesn't matter, Republican, Democrat, that this is not about a party issue thing. You guys need to bring your focus back into the county level.
Yes.
And so I want everybody
And
to
the Constitution.
And the Constitution. Here we go, guys.
And real science.
Real science,
Yes.
and real Constitution. I carry this. This is my signed permission slip. It will be with me everywhere. And my kids, It's big. It's a California Constitution. It has a Magna Carta in it too. It has all the founding documents of our natural rights. These don't come from government. We don't need a permission slip from the federal government to come in and do anything. And we don't need a permission slip from Gavin Newsom to come in and do anything. They're innate, natural born rights from our creator. So I just want to make sure we cover that, but we can go back to Stanford, because that is in my neck of the woods also, the Stanford.
Yeah, you're totally right, Heidi. And you're going to talk about this in a little bit, but it is incredibly important to let's take our focus off the federal government, because the federal government cannot save the states. The people made the states, and we need to continue to fight for our freedoms and our Constitution here. But we need to start hyper focusing on our counties, on our local governments that are like these sheriffs who can continue to be sheriffs time after time, and nobody really looks at them. And they can be like the San Joaquin County Sheriff here was incredibly corrupt. He ended up getting impeached. Or not impeached, but he ended up taking a seat. We need to focus on these county lines, and we need to focus on our county representatives, because that's really where it all starts.
Yeah, if there's something we do agree with Gavin Newsom on, it's his saying that localism is determinative. We do agree with that. That's what we've been saying for a long time is if you want to, change the world, work at your county level to and in particular right now, never more than ever, is who are the people managing your county, in particular your county health officer and your sheriff, as well as then your mayors and board of supervisors and such. They are going to be the ones that determine what your battle looks like. Are they going to be enforcing these orders and making more stricter and stricter, or are they going to look at data and science that's emerging? Are they going to seek real solutions, therapeutic and constitutional? Are they going to protect and preserve rights while finding a way to balance the risk with, again, real data, real therapeutics, and things like that, like you would expect from a free and just society? So, I mean, we could either swing into the Stanford piece or the sheriff of Contra Costa County. They're both local.
Yeah, since we're local, let's go to the sheriff, since we were kind of just talking about the sheriff. So the breaking news today in Contra Costa County was that a church in Richmond was cited for holding an Easter service. It says that there was anonymous complaints filed. So again, anonymous, we have no idea. And that sheriff's deputies went in and saw, as the article claims, that there were 40 people there not wearing masks, and that they were, causing a problem. The interesting thing is the article does not state that they shut it down. Instead, it says that they came back the very next day to issue a citation, a misdemeanor. I'm assuming it's to the pastor. The article was really gray. There was a lot. It did say to the pastor. Yeah, go ahead.
Yeah, to the pastor. And then the sheriff filed the case with the Contra Costa County DA's office for prosecution. And the violation was a misdemeanor citation for violation of the health officer order, which was California Health and Safety Code 120295. Health officer order. That's county health officer order. And let's see. The quote from the Contra Costa County Sheriff says, "Our focus has been on education of the health officer order. And in the vast majority of cases, we ask for voluntary compliance, and that solves the problem. This was different. The pastor refused to cooperate and put the lives of dozens of parishioners at risk." That's what he said, because the pastor didn't stop his service. When he was asked to. He finished his Easter service for his 40 congregants.
And so our concern is we do not feel like this was an accident whatsoever, that this church was singled out, that it was specific to Contra Costa County either, because David Livingston is the president of the California Sheriff's Association. So if this is not a bigger way to send a message, or to try to send a bigger message to control there's 58 counties in California, so to control the other 57 counties, I don't know what is. And so maybe just so they could ratchet it up even further, our state attorney general took to the airwaves today as well to discuss this. Is it right if we step into that and then go back to Stanford, or?
Yeah, do.
So I just lost the quote that he had. It was pretty horrific, his quote.
Yeah.
So this is from our California State Attorney General said, "Officials have broad authority to do what they think is necessary to slow the spread during the virus pandemic, even if that trumps normal fundamental freedoms. The Constitution remains in place, and our U.S. Constitution has provisions in it to address emergencies like this." And so I don't think that there's any doubt that for the protection of people, not just for the health, but for their lives, our government must take actions which protect our communities and individuals in the community. And he is specifically squaring in on churches. We've been talking about this over and over again for weeks and weeks. The church is being, they're in the crosshairs, guys. And I don't know how much more we can sound the alarm about that, but constitutionally, they're on very shaky ground, and they are relying on these fear tactics, and they're relying on an uneducated public that does not understand their innate constitutional rights. So yeah, we'll see if the DA actually goes far forward with it and really presses these charges. That's the other thing too. There's multiple steps before we get there. It's not just the one.
Again, yeah, your county DA, the county DA is another important player in this mix right now.
Mm-hmm.
Yeah, they're going to be the one, you know.
Denise, we can't hear you.
I don't know why. Let me see.
Denise, we can't hear you. Okay, I think we lost Denise for a minute.
So,
Tara, do we want to now move into, is there anything else we want to talk about our Attorney General, or we're moving to Stanford?
I know, like local, right? Yeah, let's move into a couple of things around, okay, oh, you talked about the constitutionality, or the Attorney General did, of California. Again, yes, the state has, you know, the ability to invoke emergency powers, but again, have they showed a compelling state interest, and are they narrowly applying this and in the most restrictive fashion? And I think that's where, you know, the battle's going to be. There hasn't been a battle, a formidable battle against Jacobson in 100 years since it came about. And this is what this is going to be on the public health grounds. And things like what we're going to talk about now are going to really, you know, bring up the point that all this was done on faulty modeling, bad numbers, manipulated data, and a study out of, well, actually, before I get into the Stanford study, how about this? So there's therapeutics as well. We know that the death rates have been going up and people's fears have been going up, in part also because there hasn't been active work on therapeutics. It's all been focusing on ventilators, which are not therapeutics and are very risky, and on future vaccines. And so today, according to the American Association of Physicians and Surgeons, 29 states hinder or block physician access to hydroxychloroquine to treat coronavirus. Racketing and crimes against humanity right there. And that's, you know, setting people up for failure. That's setting our communities and humanity up for failure in having effective therapeutics. I mean, they're out there. Those therapeutics are out there, and let's talk about that after too. But they don't have access. That it's being blocked. So separate from that, we wanted to talk about the Stanford study. Heidi, do you want to go into that, or do you want me to?
Go ahead, take it right now, since you have, or do you have it up? I can pull it up if you need it.
I do. So amazing. John Ioannidis of Stanford University Department of Medicine published on April 11th. They did a study from Santa Clara County. It's their seroprevalence sampling of a large regional population, and they determined that basically, let me get to the bulk of it. It suggests the number of infections is 50 to 85-fold larger than the numbers of cases currently detected in Santa Clara County. They also say, I'm looking at let me pull a different quote from it. I had a better one. And let's see, which also, it shows so 50 to 85 times underestimated number of infections, therefore 50 to 80.
We just lost your sound. We just lost your sound. Wow, they do not want us talking about this, Tara. We lost your sound. You have to unmute. There you go. We lost it. You were saying that the COVID-19 mortality rate may be overestimated by 50 to 58 times. So basically, they've messed this up huge. Also, last we saw the death rates. You know, we have I don't think we've broken 1,000 yet in a state of 40 million. So it's infinitesimal, the death rate on this. And so you can tell this is all, they have a different agenda. This is not about a virus, guys. Yes, there is a virus. Of course, we're not saying there's not a virus, but they're using it as a way to control you, just like the Patriot Act did back in 2001. Tara, do you want to jump back in?
Yeah, my mute button just went off on me. Sorry. I don't know what part got heard, but basically the study out of Stanford, where they tested a lot of people out of Santa Clara County, found that there's 50 to 85 fold greater incidence of infection and 50 to 85 fold lesser rate of more fatality, meaning that there is a lot of already herd immunity out there. There is a lot of people that have already been infected, and the rate of fatality is so low that the quote from it is, this is literally, this is the quote from John Ioannidis of Stanford University School of Medicine. Our Santa Clara County seroprevalence study is now out. It shows 50 to 85 times underestimated number of infections, therefore 50 to 85 times overestimated infection rate fatality. The infection rate fatality is in the ballpark of seasonal flu, 0.12 to 0.2%. And that lines up with a lot what we've heard from other doctors that we know and ER room physicians, that this isn't even as, overflowing in their departments as H1N1 flu was, which, none of them were wearing masks and shutting down the economy for.
No, not at all. I clearly remember working during the H1N1, and I remember the HR department like bringing me gobs and gobs of stuff that I had to post in my office, and we had all these meetings, and they're calling and they're freaking out, and I'm like, what is going on? Okay, yeah, I'll put this sign up and I'll put this sign up, but that was nothing compared to what they are rolling out now. And so it's like, they know this, I don't know, this is my conjecture here right now, but they know the truth is getting out. So that's why they're ratcheting down even harder, because now we're seeing these mandatory masks that are now, the public health orders continuing to be ratcheted up. We know it just happened in Sonoma County last Friday. Now a bunch of Bay Area counties are going to get it this Wednesday, and Orange County got it on Monday. So Southern California, Riverside County, Orange County, I think LA County, they all got the mandatory masks. I believe it was on Monday. They claim, there was a quote somewhere, I wish I had it, I got to find it, but they're like, in order to loosen up or to go back, we need you all to wear masks in public. Like, do you guys understand the logic of this? To loosen the restrictions, we're going to cause more mandates and more restrictions, because they know that.
And everyone should look at the county orders, the executive orders of county or state on each new restriction like this, because you might find things in there. One of our friends, Melissa in New York, they just were under that order now today to wear masks into the grocery store, and she brought in a copy of the executive order showing that, and I don't quite recall the exact wording, but if you have a medical issue where you can't wear a mask, or if you are essentially practicing social distancing, it doesn't use that word in there, that you aren't required to. So again, look at, we'll post hers so that we have a more accurate wording for the people in New York on that, because I want to get it right. I don't want to say it without it being fully accurate. So sorry about that I didn't have it exact. But I guess the most important piece is to look and read your executive orders, and then go talk to the people in your communities, like Melissa in New York did, where she went into her grocery stores, gave them a copy of the executive order, said, for various reasons, I will not be wearing a mask, very kindly told them, here's the executive order, I'll keep it on me, and I'll be, maintaining care while I'm in the grocery store, but this is, where I'm standing. So I think that was it's a really important reminder and an action step that everyone can take to realize that, we have to start reading these new restrictions on us and pushing back on them and having conversations at every level, including local, on them.
Yes, we do, more than ever.
And how about
the past? Go ahead.
Well, and then again, another piece of this whole equation that they, of the fear that everyone's experiencing, that's like allowing, that they're using to, allow these lockdowns to continue, to allow these measures, and to push for the coming mandatory testing and mandatory contact tracing, which is surveillance tracing, is the fear that there is no solutions to this, that this is wildly deadly at a mass level, which again, numbers are not proving that at all. I mean, no one's saying it's not, there's not an issue and that people aren't dying. But honestly, a lot of the people who are coming down with severe coronavirus, they deserve justice because they have not been treated the way they should with like an honest and just therapeutic process. I mean, really, it is crimes against humanity how people have been left on their own without therapeutic tools, without easy access at early point when they could be supported and helped, and the fear would come way down, and then people would actually have the best health outcomes that everyone does deserve. So for example, on the High Wire today, they interviewed, and it's a really great video because they cut a short one of 11 minutes. They interviewed Dr. Bronstein and Dr. Ng, MDs out of New York, I believe. And they've been treating, they treat people, they've treated over 100 people outpatient. And they are doing, if someone has a low level, a fairly mild to moderate form of coronavirus, they give them oral ACD and iodine. And then if it gets a little more severe, they do the nebulized hydrogen peroxide and iodine. And then if it's even more severe, they'll do an IV vitamin C and IV peroxide. And they have not had, of over 100 patients, some very, very ill, they've not had a single one have to be hospitalized or go on a ventilator or die. They even go out to their patients that are very ill who come in cars, and they'll go out into the parking lot in their full PPEs with their IVs and give them their treatments. So, I mean, that is really heroic, and that is how medicine should function, really. And they're doing this all without mainstream pharmaceuticals. I mean, these are overt medicines. Don't get us wrong. These are real medicines. IV vitamin C has an overt drug effect. So does, hydrogen peroxide. So these are very real and serious things that trained professionals handle. It's just outside the normal scope of the medical model or the pharmaceutical model of medicine that we live within. So if people realize that, or how hydroxychloroquine and Z-Pak and zinc sulfate and such combined with vitamin C are being used successfully and can be, then the fear would be down and nobody would be begging for them, their rights to be taken away.
Yeah, absolutely. I was very encouraged to learn that here in the Bay Area, there are people being treated with vitamin C IV infusions. And there are mobile clinics and there are outpatient clinics where you can go to get this. This is the time to start networking, especially with your holistic networks. They already know where these doctors are that have the training on the proper procedures to do these alternative treatments. So you don't have to go to the hospital. There are other places that you can get the treatment that you need for this. A lot of times you do have to pay it, so I do understand that a lot of people are stuck going to the hospital because of their insurance. So I get it. It's the system by design. And again, I did see something came out too. They're supposed to be opening up again the Affordable Care Act for people who lost their jobs so that they can now get into the marketplace again, meaning for the insurance. I didn't get all those details about that, but I just saw that flash across my screen. So I'm going to do my commercial again one more time, my non-paid, I don't get anything, to say there's healthcare co-ops too. You guys can join that. You step completely out of the insurance model. So anybody you know who's lost a job, you can join a healthcare co-op today and instantly get covered through many of these healthcare co-ops that step far outside of the traditional insurance model so that you have full control over your health.
I will say that we'll link again. I think right at the beginning of this, we linked almost a month ago, we linked Dr. Bronstein's information on protocols. And again, they're treating orally. I mean, this is stuff you can do at home. They have on his blog, he has like his recommendations, and oral ACD and iodine is handling the bulk of the cases. And then, so, you know, nebulizing under the care of a, you know, an alternative doctor or medical doctor is, again, an affordable treatment. And IV vitamin C is relatively affordable.
Yeah.
But again, that's only for the most extreme cases. And then let's not forget that hydroxychloroquine, Z-Pak, and zinc sulfate are very affordable. Hydroxychloroquine, I think the whole dose is, they've been talking about in the $20 range. So, you know, there's something very interesting on that Stanford study that they said at the end of it, that data from Santa Clara County that basically suggests, they say, this new data should allow for better modeling of this pandemic and its progression under various scenarios of non-pharmaceutical interventions, meaning humanity has had it and is out here living either in isolation or as essential workers or in and out and about, and their bodies are handling it and recovering from it. So, and that's even without this, like Dr. Bronstein's protocols and such, which are affordable and applicable to a lot of people.
We actually are at almost 40 minutes, so we should wrap this up. And on my end, I think I'm being so shadow banned, I can't even see comments coming up. Like I can see there's a few, but they don't like my account. I can't see much. So, I don't know if there's anything else you want to say before we wrap up.
We should do a quick live over the weekend just right before Monday. Because,
right.
You know, and watch wherever you are in this country, watch and see, because there'll be people going out to their parks this weekend. There'll be people going to their town, you know, to their downtowns. There'll be people everywhere going to their governor's mansions or state capitals, and look for them in your area and join with them if you feel comfortable.
Yes. And we will be.
Because it's on us.
It's
on us to fight this.
Yes, most
And
definitely.
to demand, to demand the protection of of our constitutional rights, and to also, you know, show them that they don't have, that we know that they don't have the numbers, the data, the science on their side. They've been manipulating it and straight up lying, and that we will not accept conditions of tracking and testing for our participation in society. Just, we will not. That's the grounds of our enslavement. We have to draw the line there.
Yes, hard line that we're drawing. So we're going to wrap this up now, guys. Thank you so much for watching. If you catch this on the replay, please make sure to comment replay and any other comment. We have a YouTube channel that this will be uploaded onto. We're on Instagram, Freedom Angels Foundation. We have Twitter, Freedom_Angels, and we have Telegram, Freedom Angels. Our email is freedomangels@protonmail.com. So freedomangels@protonmail.com. If you are writing to us, please be super specific in your subject line. I'm going through thousands of emails right now. That's a good problem to have, but make it as easy as possible for me. So make sure that if you're wanting to get involved, you are putting pushback and then your county and the state that you're in, or if it's something different, just super specific in that subject. So as we scan, we can find the thing and go through it. But we are trying to respond as quickly as possible. There is no database that your information goes into, because I care that much about your privacy that until I find something that's safe, I'm not dumping it anywhere, and I'm not sharing it. We're not sharing it with anybody either. So
we'll try to do a quick live, maybe a short 5-minute one with Denise this weekend.
Yes.
Maybe Steph can jump in on Sunday as we get ready.
Okay. See you guys later. Bye.
See you guys soon. See you on Monday.